I'm Dr. Nathan Thompson. Today's exercise is the CTU pull, or the cervical traction unit pull. So the CTU pull is for anyone who has lost a normal curve in through the neck, or people who demonstrate a lot of what's known as forward head posture, or that granny posture. So the purpose of why we do that is to help strengthen the muscles in the front and the back in order to start pulling the head and start restoring that normal curve in through the neck. Now what we're going to be using for this is we're going to be using your traction unit. Now this is also a fixed procedure, so make sure that you actually properly warm up the spine using your cervical traction unit by doing your repetitive cervical traction first. Now we're going to take this unit off your door, we're going to take it off of the wall, and we're going to use this as a separate exercise. So Kelly's going to demonstrate what the cervical traction unit pulls actually look like. So the first thing is we're going to be using that neck part, we're going to be placing it behind the neck, and then we're going to be using the fatter roll, and we're going to be in the handles, and we're going to be holding it just like that. Now there's three things that you want to do every time that you do this exercise. The first thing that you want to do is you want to actually pull forward. Next thing you want to do is you want to tuck your chin, and then the last thing you want to do is you want to extend your head. So there's 4 different variations that we can actually do this, and we'll show you all 4. So the first one is known as 30 degrees down. So Kelly, I want you to make sure that the traction unit is pointed 30% down, 30 degrees down. So she's going to go ahead and she's going to pull, she's going to tuck the chin, and then she's going to go ahead and retract. Now she's going to hold that for the required amount of time, the prescribed amount of time, and the prescribed amount of reps. So you can see if we did this for 10 seconds, she's going to hold that for 10 seconds, and then she can rest for 10 seconds, and then she's going to do that for 10 seconds again. So again, she's going to pull, tuck, and then she's going to retract the head back, and she's going to hold that for 10 seconds. So this would be 30 degrees down. The next thing that we're going to do is this would be 30 degrees down with a shoulder roll. And the reason why we have that shoulder roll, especially for people who are missing a lot of the curve in through the upper part of the back, so we're trying to increase the curve in between the rib cage. So for this one, we're going to add one more thing. So we're going to go ahead and we're going to pull, we're going to tuck, we're going to retract, and then we're going to roll the shoulders forward. So you can see how she rolls these shoulders forward. So that would be the 30 degrees down with the shoulder roll. You can go ahead and relax. Now the next one that we're going to do is we're going to do one that's known as straight out. So instead of going 30 degrees down, we're going to go straight out in a straight line. She's going to do the same thing. She's going to go ahead and pull, tuck the chin, and then she's going to retract the head, holding that for the prescribed amount of time. And then the last one is going to be straight out with the shoulder roll. So Kelly's going to go ahead and pull straight out, tuck the chin, retract, and then she's going to go ahead and roll those shoulders forward. So you'll see that curve in through her middle part of the back actually increases. So just make sure you hold that for the prescribed amount of time and then perform the prescribed amount of reps. One final thing with that is that a common fault that people do is that they tend to pull too hard and then they start leaning backwards. So you want to pull very firmly, but not so much that you see that your rib cage is actually bending backwards. So go ahead and show one more of what you're bending backwards too far. There you go. So you want to make sure the body stays upright when you're doing the CTU pull. Again, this is the CTU pull.